Hi, my name is Danae Narvaza, and I am a pelvic floor physical therapist here at Pelvic Health and Rehabilitation Center located in Encinitas. Today, I'm going to be discussing myofascial decompression, or also known as cupping. So there's two types of cupping sets that you may find us using at our clinic. It will either be the silicone cups or the plastic cups. So the plastic cups typically come with a pump suction device that almost looks like a little gun. And then the silicone cups do not have the pump suction device or any of the valves, so you're able to just squeeze it to use it. Some differences about the silicone versus the plastic cups. I feel that with the plastic cups, since it has a pump suction device to help intensify or decrease the tension of the pressure used, this is a good option for those who might want more intense decompression, or also the option to decrease the intensity of the decompression. Also, sometimes the plastic sets will come with magnets. If you're not familiar with Eastern medicine, then you can just simply remove them. But if you are familiar, you can go ahead and keep them on there. Meanwhile, like I mentioned earlier, the silicone cup does not have a valve or pump suction device required. You just squeeze it and apply it. I think that the silicone cups are good for beginners, as it is not as intense in terms of pressure for the decompression. Also, I think that the silicone cups are good for beginners because it's less aggressive of a suction. So some words of caution if you plan on using cupping. 1. Do not use cupping as a modality for you if you are on blood thinners. 2. Do not use the cupping set over the eyes, over any burns, sunburns, open wounds, or recent traumas. And 3, especially with the consideration of pregnancy being so prevalent with pelvic health, you should not use cupping on the lower abdomen or the upper abdomen during pregnancy. Low back is fine up until the 6th month of pregnancy. However, light and very moderate intensity should be used. So next is, how exactly should we use our cupping sets at home? Do discuss with your therapist your plan of care and the intentions of cupping. This might be for a specific muscle group, it might be for a specific region of the body to help with decompression along a nerve, etc. Everyone is individual, so you want to make sure that the treatment that you are doing at home is specific and individualized to your plan of care. Another consideration is please do pair it with body oil and or a body lotion. Think of it like a water slide without water. Sometimes with cupping, you will be advised to do it dynamically with motion, and you don't need that extra friction to irritate the skin. Speaking of movement, there are 3 types of ways that I like to use cupping for a modality. There's statically with intrinsic movement, and then there's dynamically, where the cups will be moved along the skin itself. So, just to debrief, static is typically where you place it on a desired or specific area. You could leave it on there for 10 minutes. If you are new to cupping, then maybe leave it on there for 5 minutes, remove the cup, assess the skin, and see if you're able to tolerate 5 more minutes. Another option is statically with some movements. So, for example, I have a lot of patients who are busy or will like to multitask and decrease time spent doing certain home exercise programs or modalities at home. I like to advise to place the cup on the desired body part and add movement to it, because when we're moving, our muscles, our fascial lines are also moving underneath those cups, and it makes it a little more dynamic. And thirdly, just general dynamic movement of the cups directly while having them on your skin. So this could look like having the cup placed on the skin and moving it with body lotion or body oil so there's not irritating friction. Oftentimes, I like to pair this with a colon massage as well, and you get to feed two birds with one seed, essentially.